This is a case of chronic tonsillitis, and we have planned a Coblation tonsillectomy for the patient. We have already done the right side tonsillectomy, and now we are performing the left side. I am holding the tonsil with the help of Alice forceps, and I am dividing the mucosa at the level of anterior pillar with the help of the Coblation wand. The wand is EVAC 70 from Smith & Nephew plasma wand. We are using the wand at a setting of 7 for ablation and 3 for coagulation. The first goal of our surgery is to find the correct plane of dissection. Finding the correct plane will help us to do a bloodless surgery. We have to maintain a good traction and counter traction all the time during the surgery, as this will make our plane more visible. We have to divide at the junction of the fibrous tissue and the tonsillar tissue. The fibrous tissue is the one which connects the tonsillar tissue with the bed. So our aim in this dissection is not to expose the tonsillar bed muscles, as exposure of the muscle will lead to myositis and which will lead to post-operative pain. So we have to open the tonsil like a book, and we have to divide at the junction of the fibrous tissue and the tonsillar tissue. As you can see, at the point of dissection, there is no bleeding. There is a minor bleeding from the tonsillar tissue from where we are grabbing it. It is because the Alice forceps is a little bit traumatic forceps. Otherwise, at the dissection, there is no bleeding. So till now, this is a bloodless surgery. The tonsil is opening up like a book. We have to do equal dissection from all the sides. Minor oozing can be stopped with the coagulation mode of the wand, and we have to maintain a good amount of fascia all over the tonsillar bed. You can see the maximum area of the tonsillar bed is covered with the fascia, and this will ensure that the patient will not have pain in the postoperative period. The tonsillar tissue is little bit more adherent at the lower pole, so we have to do a more dissection at this part. Keep rearranging your grip so that you can maintain a good traction at the site of dissection. The movement of the wand is critical. You have to maintain the correct speed in the movement of the wand, as slow movement will cause a charring of the tissue, and if you move the wand too quickly, it will lead to bleeding. So, as you can see, the tonsil has come out. There is only a small pedicle from where it is attached. So this is how you do a Coblation tonsillectomy, and you can see a good amount of fascia which is present at the tonsillar bed. As this was extracapsular tonsillectomy, it is not possible to maintain the fascia everywhere, but we have to try to maintain at maximum areas. So you can see all the tissue has come out.